I'm Dan Hergert, and today I'm going to be talking to you guys about hypertension. So what is hypertension? It is defined as the prolonged increase in blood pressure due to vasoconstriction. So what this really means is, what you're going to see is a decrease in the diameter of the artery walls. The arteries are going to deliver blood to the tissues so they can give oxygen and nutrients to the tissues. The values for systolic and diastolic blood pressure are as follows. Normal blood pressure is defined as a systolic blood pressure of less than 120 and a diastolic blood pressure of less than 80 millimeters of mercury. Elevated blood pressure is defined as a systolic blood pressure of 120 to 129 millimeters of mercury and a diastolic blood pressure of less than 80. Stage 1 hypertension is a systolic of 130 to 139 or a diastolic of 80 to 89. So if either of those values are in that range, then it's considered stage 1 hypertension. It does not need to be both. You can have normal diastolic and elevated systolic and still have hypertension. Stage 2 hypertension is a little bit higher, so it's greater than 140 for systolic and greater than 90 millimeters of mercury for diastolic. And then stage 3 hypertension is going to be greater than 180 systolic or greater than 120 diastolic. So primary hypertension is, it has no identifiable cause but develops over years. So with this, you're going to see a steady increase in blood pressure over a long period of time. In secondary hypertension, it's going to occur suddenly and cause higher blood pressure than primary hypertension. And if the blood pressure gets too high, this can be a medical emergency and you'll want to go to the doctor. So the pathophysiology of hypertension. The vasoconstriction in the arteries is going to cause an increased afterload, making the heart work harder. So when the artery diameter is decreased, the heart has to pump the same amount of blood into a smaller space. So this is going to cause the heart to work harder, which is going to damage the heart over time. You're also going to see a decrease in renal blood flow, which leads to an elevation of the renin-angiotensin-aldosterone system, aka the RAS system. If you have an elevation of this system, you're going to see a further increase in vasoconstriction, as well as an increase in sodium and water retention, and a decrease in potassium, which are all more risk factors for hypertension, so you're just going to compound the problem. So some risk factors for hypertension. The first one is age. So with age, you're going to see a decrease in vessel function. Middle-aged men and postmenopausal women are both at higher risk for hypertension. Race is a risk factor as well. You're going to see a higher incidence of hypertension in African Americans. Being overweight or obese is an issue as well. When you have more tissues, it's going to result in an increased need of oxygen and nutrients to those tissues. So what happens, the body's going to compensate by increasing blood volume, which exerts more pressure on the artery walls. Physical inactivity is a risk factor as well, because it's going to lead to an increased heart rate, which makes the heart work harder. Tobacco use. So tobacco use is bad because it has nicotine in it. So nicotine is going to acutely raise blood pressure, and then the chemicals in the tobacco are going to damage the artery walls over time, leading to more issues in the long term. Stress is a problem because it's going to lead to a temporary but significant increase in blood pressure due to stress hormones such as cortisol. And you're also going to see more of an activation of the sympathetic nervous system. Stress is a really big issue because even if somebody is seemingly healthy, even if they exercise enough and eat properly, you can still see high blood pressure due to high levels of stress. High sodium is a risk factor because it leads to fluid retention. So again, you're just going to see more fluid in the arteries, which is going to exert more pressure on the walls. Low potassium is an issue because potassium's function is to balance out sodium. So if you don't have enough potassium, you're going to see high sodium levels, and again leading to the water retention and higher blood pressure. Alcohol use is an issue because it damages the heart. It also leads to stress hormone release, such as cortisol, and it's going to increase the sympathetic nervous system activation. So you're going to see acute rises in blood pressure. But if you do that over and over and over again, it can lead to chronic increases in blood pressure. So some manifestations of blood pressure include fatigue. You're going to see fatigue because the heart has to work way harder. You're seeing the stress hormones elevated and the sympathetic nervous system elevated, so that's going to wear the body down over time. Headaches are an issue because you're seeing a lot of fluid retention typically with hypertension, and that fluid retention, if it's in the brain, is going to lead to pressure on the brain, and that's going to result in pain. You're also going to see malaise, which is defined as discomfort, uneasiness, or pain. Typically is present during the onset of disease, and then dizziness as well. So some complications of hypertension include the following. Atherosclerosis can be an issue. What you're going to see there is an increase in plaque buildup in the blood. If enough of this plaque builds up, it's going to decrease the diameter of the arteries even more, leading to an inability to effectively pump blood and deliver oxygen and nutrients throughout the system. This can result in stroke. So stroke is when you have a blockage of arteries to the brain, and you don't get enough oxygen or glucose to the brain, and that's going to damage and kill brain cells, which can lead to devastating long-term effects. Vision loss is an issue as well, so if blood circulation is cut off to the eyes, then you're not getting enough oxygen and nutrients to the eyes, and that's going to lead to issues, again, so vision loss. Hypertensive crisis. So hypertensive crisis is a large, acute increase in blood pressure. If systolic is greater than 180, or if diastolic is greater than 110, that's when you're in hypertensive crisis. And something like this can be really dangerous, so if you do have blood pressure that high, you want to get medical attention immediately. And then finally, there's metabolic syndrome. So metabolic syndrome isn't a disease in and of itself, but rather a collection of risk factors. So some of those risk factors are going to include hypertension, high blood sugar, large waist circumference, and these things lead to more complications over time. So on to my case study. Miss C is a 42-year-old African-American woman. She has a 7-year history of hypertension, which was diagnosed during her last pregnancy. She has a family history of hypertension and cardiovascular disease. Her mother died at 56 years old. She had hypertension and CVD, and both her maternal and paternal grandparents have CVD. So that's going to be a major risk factor for her as well. She has a 25-year history of cigarette smoking. She smoked a pack a day pretty consistently for 25 years, and she has moderate obesity. Her symptoms include headaches and fatigue, which are commonly seen with hypertension, and her treatment has been ineffective because she takes her medication irregularly, and she's failed to modify her lifestyle risk factors such as smoking, diet, and exercise. So the lab tests have revealed the following information. Her serum sodium levels are at 138 milliequivalents per liter. So that's actually within the normal range because you want to be anywhere from 135 to 147. Serum potassium is a little low at 3.4 milliequivalents per liter. And again, the range there is 3.5 to 5, so she's just a little bit low. Total cholesterol is 268 milligrams per deciliter. It's a little bit elevated because you want to aim for less than 245. Triglycerides are significantly elevated at 230 milligrams per deciliter. You want to try to keep that below 160. And then finally, fasting blood glucose is in the proper range at 105 milligrams per deciliter because you want to aim for 70 to 110 there. So several of her risk factors and symptoms are consistent with the literature, but not everything is. So she had pregnancy-induced hypertension, which is commonly seen. It's one of the primary causes of hypertension. So it's no surprise that she got hypertension during her last pregnancy. She suffers from fatigue and headaches, which again are very common symptoms of high blood pressure. And again, that's mostly going to be due to the heart having to work harder to pump the same amount of blood and the fluid retention in the brain. Family history is a major risk factor, and it's called a non-modifiable risk factor, which means that you cannot control it. And like I said, her mother died of cardiovascular disease and hypertension, and both sets of grandparents have hypertension or have cardiovascular disease. So that's a major risk factor for her. Her elevated total cholesterol and triglyceride levels are commonly seen in the literature, and they're a major risk factor. However, her sodium levels are within the normal ranges. So that's usually something that you see elevated with hypertensive patients, but for her, she's actually normal there. So in terms of her treatment, smoking cessation should be higher priority due to the fact that her sodium levels are normal and she's only mildly obese, and her family history is a non-modifiable risk factor. The major thing is smoking, because remember, she has smoked a pack a day for 25 years, and that's a major modifiable risk factor. So stopping that should be heavily emphasized in her treatment. And she also, again, she is mildly obese, so diet should be emphasized more. And she's also got the elevated lipid levels, the total cholesterol and the triglycerides, so she should try to work on that. She was prescribed ACE inhibitors and took them for 3 months, but what they saw was she didn't change, or her blood pressure didn't change at all. So, and this really shouldn't be seen as a surprise, because there's a lot of research out there that says ACE inhibitors are ineffective in African American populations. But what has been shown to be effective with African Americans are diuretics and the calcium channel blocker diltiazem. They've both been shown to be effective at lowering blood pressure in African Americans, so these should be prescribed in her case. And here are my references.